All right, so there it goes. Okay, recording's in progress. All right, so good to see everybody. This is a slightly different topic than I've done before here. So I actually, this, I was debating about what to do. So normally I talk either cannabinoids or long-acting bupe or things like that. I was actually a little terrified 2 weeks ago when I heard we were talking about cannabis. I second guessed myself and thought I was supposed to be speaking and not Mark. So I was grateful that he did. But I wanted to bring up a slightly different topic. This is actually one that I presented in I look back, it was May of 2019 when I was doing grand rounds, and I was still a resident here. And it's about assertive treatment, so basically assertiveness. Many people feel aren't too familiar with it. I know we have folks with psychiatric backgrounds or therapy backgrounds, and hopefully this rings a bell. But I think it's a very interesting topic and one that's applicable not just for our patients, but also for us as staff. So this is today. Oops, sorry. Let me go to the next one. That's where we work. I don't have any disclosures. I don't have any pharmaceutical ties. Special thanks actually to Dr. Larkin. He doesn't really do a whole lot with addiction treatment, but he's a PhD. He was my mentor back when I was in medical school, and he taught me a lot about CBT and assertiveness and actually helped me develop this talk way back when, 6, 7 years ago. Also to my family. I had pictures originally in it of my son, and I wanted to keep them in and also add some newer ones with my daughter too. So sometimes I'll do like jokes and things, but this is going to be a show and tell with the kids. So this is actually my son, my wife. This was way back when, so he was only 6 weeks old when I was graduating medical school, and now he's about to be 10 years old, literally a month from today, which is kind of crazy to think about. But that's him as a little Dr. Baby outfit. So great kid. All right, so the goals and objectives of today, we're going to talk a little bit about assertiveness and assertiveness training. We're going to define and compare assertiveness to other styles of communication, teach a little bit of assertiveness techniques that you can use, go into a little bit of application for patients and also interprofessionally, and look at what assertive treatment could represent. So when we think about assertiveness in general. So what is assertiveness? So this is my son when he was a little bit older. He was assertively wearing some boxer shorts on his head, which I love. But he was a little chubby guy, but a good little guy. You're not very assertive when you're 3 or 4 months old unless you're crying a lot. So that's him back then. But assertiveness actually comes from this guy's kind of the godfather of assertiveness, Andrew Salter. So he was the founder of assertiveness training. He was actually a big critic of Sigmund Freud and a proponent of more behavioral therapy, so more like your CBTs and your ACT type therapy, DBT, things like that. So he believed that inhibitory personality traits, so things like avoidance and passivity, form the basis for most neurotic disorders. So this led to what he called a conditioned reflex therapy. This is why he developed conditioned reflex therapy. So he really wanted to have an emphasis on assertive and expressive behaviors to combat a person's existing inhibitory traits. So if someone's kind of naturally introverted or avoidant or passive, it was how can we counteract those a bit. So his work, the conditioned reflex therapy, he taught these excitatory exercises, which basically served as rudimentary assertiveness techniques. And amongst them was including the intentionality of using the word I, which we'll talk about, I statements. So this really formed the basis for subsequent assertiveness treatments, which we'll go over a little bit more in the history. Joseph Wolpe. So he took these Salter's techniques and applied them to his theory that someone could not be anxious and assertive simultaneously. So the idea that you cannot at the same time be both anxious and assertive. So you kind of have to choose one or the other. So choose being assertive in communication as opposed to being anxious. So he developed assertiveness training as a form of reciprocal inhibition to treat anxiety. So again, you're picking assertiveness over your anxiety condition. So teach people to be assertive, they become less anxious was his basic idea. So his work with assertiveness led actually to the development of the systematic desensitization, which is often used to treat phobias and other anxiety disorders. So things like OCD. Kind of interesting. A little bit more in the history. Thomas Gordon, he was a clinical psychologist who believed that coercive powers led to damage in relationships. So if you had like a coercive spouse, a loved one, that would actually cause problems. So he developed skills to teach assertiveness, what was called the Gordon method. Among them is win-win strategy. So the idea that you can resolve conflicts through effective communication, active listening, which most of us are probably familiar with, I messages or I statements as opposed to using you statements. And we'll talk a little bit more about this later. And therapists often would use these in anxious patients. This could also be applied in societal gender roles. So historically, if you say you had more of like a passive spouse, somebody's like a housewife, or house husband, or whatever, teaching them to be more assertive and more involved in their own in the relationships, I guess you could say. So a little bit on terms of assertiveness. So here's a definition of it. It's a style of communication that empowers its users to speak out and stand up for themselves in clear, respectful ways. It allows for confident expression of your needs and feelings. Being assertive means expressing your wants while being mindful of the opinions, wants, and feelings of others. You can imagine how this could be very applicable both as a provider of people who struggle with substances, but also to people, say, in early recovery who have difficulty asserting themselves and asserting the fact that they're trying to remain abstinent from drug use. This is my son not being very assertive, but he's just kind of hanging out when he was little. Don't scare me. I poop easily. It's like that shirt. All right. A little bit in comparing assertiveness to other forms of communication. So besides assertiveness, you have being non-assertive, or we'd say passive. On the other spectrum would be more of an aggressive style of communication. So for people that are more non-assertive or passive, you don't really get to express your feelings, wants, or ideas. So you keep them bottled up because you're passive and you don't really want to share things for one reason or another. On the other side, if you're too aggressive, you express your feelings, wants, and ideas at the expense of others. So you're really kind of jamming your beliefs down people's throats. In the middle is really assertiveness, where you express your feelings, wants, and ideas in a more appropriate way. The goal of being a non-assertive or passive is to really to please people or to avoid difficult situations. So that's really the underlying intent behind it. Whereas the goal for aggressive communication is more to dominate or humiliate. So it's to really take control of the situation. The goal of assertiveness is really more to communicate your own needs and desires to others, not to avoid, not to dominate, but to communicate. The result of being non-assertive or passive is generally people will get more and more anxious and they have disappointment towards themselves, often resentment. So if you bottle things up, for long term or constantly are more passive to other people, this wears on people pretty quickly. Being overly aggressive, on the other hand, you feel superior and self-righteous, later plus or minus embarrassed with your behaviors, so that often doesn't come across very well. Really, with assertiveness, if you can learn to kind of find the middle ground, is really people generally feel more confident and overall good about themselves. So in terms of non-assertive, others feel, so if you are yourself non-assertive, other people will feel superior, sometimes guilty with what they can do to a non-assertive or passive person. On the other hand, if you're being aggressive to someone, how will other people feel? Generally hurt and humiliated because, again, their wants, desires are being overridden by yours, being overly aggressive. Being assertive, really the goal is to help other people feel respected and valued. So again, finding that middle ground. Often, in addition, people will feel more pity towards you, pity, irritation, disgust, disrespect, or sometimes nothing. So if somebody is truly just a doormat, then you may have no feelings towards them. On the aggressive side, feel towards you more angry, vengeful, spiteful, hurt. In terms of being assertive, usually more respect, possible envy towards somebody based on their ability to assert. So if you've met someone that's really good at being assertive and not being overly aggressive or passive, you can feel a little bit envious to them. It's almost like a cheat code to communication that they have that we may not. A little bit more. So the outcome of being non-assertive or passive is you rarely get what you want. So if you are passive in all your communications, you rarely get what you want, and anger and resentment usually builds up in us because again, we are never getting what we want. We're never explaining what we want, what we need. We're just deferring to other people all the time. On the other side, being aggressive, often you will get what you want temporarily, but it is at the expense of others. So people do get upset. The outcome with being assertive is you often get what you want, but not always. But at the end of the day, typically people will feel more empowered because again, they've got their point across, whether it sticks or not, it's another the payoff, the end payoff really being assertive or passive, or excuse me, non-assertive or passive, is you temporarily avoid an unpleasant situation. So you avoid confrontation. So if you do avoid things, if you do agree to go along with the crowd whenever it happens, you do avoid any kind of unpleasant confrontation. So that's a short-term payoff. Payoff for being aggressive is you vent your anger in the moment, you feel superior, and some people may like causing a confrontation. So that's something you get with being aggressive. So being assertive should feel good. You get respect of others. You do have more self-confidence, and ultimately you should have improved relationships if you're being assertive, if you're being direct with loved ones and colleagues. What about being passive aggressive? So most of us have heard the term passive aggressive. So kind of interesting. This actually starts more with a passive stance, but then leads to a form of aggression. So it's examples of what really constitutes passive aggressive is like procrastination and work, covert obstructionism, which is kind of interesting, inefficiency and stubbornness. So basically saying you're going to do something and then turning around and not doing it, or just ignoring it, or doing something underhanded. Within the DSM, so it's kind of interesting. So the original DSM-1 way back in the day, so passive aggressive was grouped with passive dependent or dependent personality disorder. In the DSM-3, this was actually the first appearance as an independent personality disorder, or Axis 2, as we used to call it. In DSM-4, which we're in the 5 now, we'll go to it, but this actually got moved to Appendix B. So this was basically disorders, axes provided for further study, so not an actual diagnosis anymore. And actually, in the DSM-5, it disappeared altogether. So what we currently have in the psych community, you don't see the diagnosis of passive aggressive personality disorder, but it does actually remain on the WHO's ICD-10 codes. Kind of interesting. So one question is, does too much passivity actually lead to passive aggression? So if somebody is chronically being passive, will they end up then later developing more like an aggression on top of it? Kind of interesting. So a little bit on the passive aggressive or negativistic personality disorder. This is the last time it appeared in DSM. So this is people with a negativistic attitudes and passive resistance to demands for adequate performance, beginning by early adulthood and present in a variety of contexts, is indicated by form of the following. So passively resist fulfilling routine social and occupational tasks. So again, your boss asks you to do something and you just sort of decide not to. Complains of being misunderstood and underappreciated by others, as certainly a lot of us could probably say that at times, is sullen and argumentative, and reasonably criticizes and scorns authority, expresses envy and resentment toward those who apparently more fortunate, voices exaggerated and persistent complaints of misfortune, alternates between hostile defiance and contrition. So kind of an interesting thing, not really part of the DSM anymore, still part of the WHO, but you may see things. Does not occur exclusively during MDD or not better accounted for by dysthymic disorder. So a lot of people will have pretty negativistic attitudes towards things if they're depressed or struggling mightily, but something kind of interesting to note. So what about being nice? So we talk about being overly aggressive, overly being passive, or trying to be more this neutral assertiveness. So what about being nice? I always find this kind of interesting, being nice. So what is a nice person? So many would argue that being assertive really means that you're essentially a jerk or not being nice. So if you're trying to get your point across, if some people don't like hearing it, they might say, hey, you're not nice, or whatever it might be. Interestingly, the original Latin root is the word nicius, I believe, how to say it. Technically, I'm not a great Greek and Latin root person, but nicious actually means ignorant. It meant ignorant. So kind of nice and ignorant, or ignorance went hand in hand. So it's interesting, the root of nice. So nice was actually coined around the 14th century to refer to someone being foolish or silly. The definition has evolved, but often the connotation is not. So sometimes when you hear like, hey, that person's such a nice guy, or this lady's really nice, in some ways that's a positive, but also it can be looked at as, this person's very passive and they're not very assertive for themselves. This is an interesting book I read years back, but it's a book called Not Nice. So at its core, being nice is about being liked by others by making everything smooth. Interesting. One of the biggest traps of niceness is the pressure to stay nice. It's the idea that being a nice person is the same thing as being a good person. Behind that is the fear that if you're less nice or you aren't nice all the time, then you are a selfish, bad, wrong, and terrible. That you should feel guilty and ashamed of yourself. So the kind of this interesting idea that people try to be overly nice, and in the process of trying to be nice, you actually are being overly passive, you could say. So being a nice person does not necessarily make one a good person. It makes you good in a way that if you are around somebody that's more aggressive, that they can take advantage of that person a little bit more, but it doesn't necessarily mean that that individual is good at communicating with others, be they staff or patients. So one size does not fit all. So when we're talking about being assertive, it's not always great to be, so it's not the best course of action to always be assertive in all things. For example, certain situations demand you to be more passive. So if you're pulled over by the cops and you're trying to be a tough guy, that might get you in trouble pretty quickly. Sometimes you need to be more aggressive. So if someone's, you say, you know, getting into a fight with you or broke into your house, you can't necessarily, try to sit down and reason with that individual, right? Or sometimes even more of a passive aggressive approach. So, for example, your elected official boss asks you to do something illegal in their best interest. You might say, yes, yes, of course, I'll do that, and then turn around and actually report them to the authorities. So, regardless, you don't really want to be caught in what's referred to as the alternator, where you forgo being assertive in favor of alternating to being aggressive or passive aggressive. So the idea is you do generally want to try to be assertive in all things in your communication, as opposed to, individual by individual. I'm going to be super passive in this situation, or I'm going to be overly aggressive with these individuals. Uh, Assertiveness gives you a broader choice and really should be something we should all have in our repertoire, especially as providers. A little bit in the assertiveness training itself. So there's many treatment modalities that exist, and really want to just highlight a few basic ones, see if you're familiar with them. One is what we call I statements. So many of you are probably familiar with I statements a bit. Another is assertive nonverbal communication and body language. So just the way that we sit and talk and engage individuals can make a difference. Another one is saying no, which is incredibly difficult, especially when you're involved in academic medicine, getting pulled 10 ways at once. Another one is the broken record method. All right, so what about I statements? What are they? I'm sure many of you are probably familiar with I statements, but the goal is using more I statements opposed to you statements. So in general, just using I more. This is something I try to do with when I'm talking in groups, is I'll try to say more like we or I, as opposed to a lot of you should do this, you should do that. Trying to talk about more like the we's or the I's. So when you do use you statements, so if I say you need to do this, or you're this way, or you need to stop that, the minute you say you, it really puts somebody in a defensive position. So trying to avoid use as much as possible is probably a good thing. So saying you to someone allows them to deny your assertion. So if I say you need to do this, or uh, you make me feel this way, someone can always deny that. And again, you're more or less your default is to be on the defensive. When you say something is an I statement, it more focuses on you, and this really prevents somebody from denying your own feelings. So if I say, for example, here's three specific I statements. So What we say is if you have a situation, again, with a patient or in life in general, so one I part of the I statement is you summarize the situation, what's going on. So this is kind of a easy example, but kind of an interesting one. So let's say you are at a restaurant and you've been working all day and you're really excited and you want to get a nice steak dinner. Sorry to any vegans on, by the way, but you want a nice steak dinner and you can't stand fish. I like fish, but this example, you don't like fish. So you order a steak dinner, and instead of a take steak dinner, they bring you out a trout with the head still on, and it's looking at you the whole time. Now, the passive person might accept the fish and eat and not say anything to the individual that brought them, the waiter or waitress. On the flip side, someone who's overly aggressive might take that plate and throw it back in their face or scream at them and say, "Hey, I need to get the manager." On the other hand, you have someone who's more assertive. And these are some things you would do in that situation. So, summarize the situation. I ordered the steak and not the fish. So, more focused on not you messed this up. What did you do? State your feeling. I'm upset with the fish, or I was really looking forward to having steak and not fish. So, state your feeling. Oh, I feel this way, I feel that way, not you make me feel this way. It's I feel this way, which you can't really deny if someone says I have this feeling. And then lastly, make your request. So I would like you to bring me a steak instead of the fish. So you can imagine how that goes over much differently with someone saying, um, here's what's going on. I ordered this and not that. I'm upset because I really wanted that instead. I would like you to please fix situation. So that's just a simple way that I statements can be different than using you statements. If at first attempt you don't get a good response, a lot of times they recommend actually trying to change the order of the I. So you might say, I'd really like you to change, bring me back the steak. I really don't like fish. I definitely ordered the steak and not the fish. So you can kind of play around with it a little bit, but it's just kind of an interesting way. Instead of focusing so much on other people, you're bringing it internally and having them interpret as they want. Mentioning Gordon, our friend before, who really came up with I statements, he encouraged congruence between statements, tone, and body language. So really to try to keep the message simple and keep it consistent. So not to kind of waffle and change it if you meet resistance. Kind of interesting. Another one on more assertive and nonverbal communication and body language. So really, they recommend having good posture. So trying to stay upright with shoulders back, not hunched or overbearing. So it's amazing how different it feels if someone's kind of laying back and sort of disengaged, or someone's like really aggressively staring at you, or arms are crossed, something like that. So the goal is to have more of a neutral stance. Eye contact, comfortably direct, normal glances away, not looking away or down or staring off or not staring uncomfortably at someone. So really intensely staring at somebody for a while, that's usually more of an aggressive stance. Or again, if you're just sort of passively looking away all the time, that's more of it's more passive. Facial expression, often relaxed, reactive, no nervous smiling, clenching of teeth. Not easy, but trying to just be normal in conversation, reactive. Voice, clear, warm, and firm, not really soft or overly loud, no sarcasm or whining. That's difficult for me. I like sarcasm, but in joking terms, we can do sarcasm. Overall body language, really relaxed, balanced. Some hand gesture is fine. Obviously, no fist pointing, no finger waving, constant shifting is not great. Excessively nodding all the time, that's not exactly ideal. So more kind of a neutral stance. Is this assertive body language? I'm not quite sure. This I loved his blonde hair. It's gotten darker over time, but he's just kind of chilling. I think he has good eye contact, but the his posture isn't so great here. So he's kind of kicking it there. All right, he's a good guy.
I feel like he's relaxing assertively.
You think he's, we still have this chair, but he barely can fit in it. So yeah, it's good stuff.
I agree, PJ.
All right, he's okay. He's a good example then. So just do what he does the next time you interact with somebody. All right, saying no. Very difficult to say no. So this is extremely difficult for someone who's non-assertive or passive for them to refuse a request. So if you encounter someone or you are an individual that tends to be more on the passive side, which I would say historically I was more passive, but I've tried to be more assertive and avoid being too aggressive, but it's very difficult for someone who's not assertive to say no on request. So often, if you think about it, in early addiction recovery, saying no can really be the crucial thing to maintaining sobriety. So being able to tell people no assertively, that can be really difficult if someone's used to either A, giving in, or B, deferring to people around them that use a lot. So you can imagine this would be an important thing to teach someone. Often, underrepresented classes get many requests and feel guilty to say no. So this is more of almost in the academic world where you'll hear, certain individuals say, "Oh, you're the only addiction provider that works here. We need you to do this because you're that person." All right. It's nice and all, but we can't do all things for all people all the time. So learning to say no, certain requests is really important. Here's 5 tips for how to say no. I love. So no is a complete sentence. So if you say no, you don't have to say no and blah, 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 blah. So you can just say no, can't do it. So this avoids a lot of explaining, justifying, etc. I see some smiling faces. So yeah, it's not easy to say no. No apologies. So this shows discomfort with saying no, suggests you were wrong. So if you're like, oh no, I'm so sorry, I'd love to do it, but I can't, it's my bad, blah, blah, blah. You can just say no, I'm sorry, I can't. All right, make it about you. So this is similar to I statements. It's if an explanation is needed. So if you have to explain yourself why you can't do it, then center it on you and not the other person. So you say, no, I can't do it. I am too busy right now. Period. Another one would be warmth and appreciation. So it keeps you connected with those who rejected, with those who you rejected. So perhaps not so applicable if someone is offering you drugs. So you say, "Oh, I greatly appreciate you having offered me all this cocaine, but I'm going to have to turn you down this time." No, you can say no in this situation, but if perhaps your boss wants you to do too many things at work, you can say, "No, thank you for the opportunity, not this time." Okay, say no early. So this is tricky if you kind of acquiesce early. You say, okay, I'll do it, and then later you realize, oh shoot, I shouldn't have done that. And you say later on you change your tune. That is difficult. So if you know right off the get-go that you can't do something, just say it right off the bat. Don't kind of prolong the inevitable to say no later. So, tips that you can see how again are applicable for both patients, but also for ourselves. Broken record. This is the last one we talk about. So this is really a delicate tool that should not be overused as it can lose its effectiveness. So the idea is that if you make a legitimate request when you're trying to be assertive and it meets really more of like a illegitimate resistance, so someone's not being reasonable, or say someone's not taking no for an answer. So you tell your boss or someone tells their former friend who's trying to give them drugs, no, I don't want to use. You can repeat yourself. So broken record is just that. You are repeating what you've said before. So you repeat your request or your response in a calm, cool, and collected manner. So I said no. I mean no. I'm doing it. Try to use the same phrase repeatedly without changing it much. So again, sticking to basically the same thing you said, if it's I statements or whatever it might be. The goal is not really to wear someone down with a broken record. So this isn't necessarily to get people to do your bidding. It's just to say, okay, this is how I feel. This is what I'd like you to do, or no, I cannot do this for you. All right. So talking about small children giving in, we had a lot of fun this morning with my daughter having some homework that she had to finish. The more you do repeat a request, the less effective it can become. So if you are constantly having to be a broken record over and over and over and over again about the same thing, the message is going to be lost at some point. Something to know. All right, a little bit more in terms of applying assertiveness, and I promise we're nearly done. Certain personality traits, so more introversion and neuroticism, are associated with increased submissive behaviors or passivity. Not a surprise there. Submissive behaviors actually often signal depression, anxiety, and dependency issues. So when you have anxious, depressed, or dependent patients or patients early in substance use recovery, this is really a good time to teach people how to be assertive. So I've certainly had my fair share of folks that were extremely anxious when I got them. And a lot of it turned out was because they more or less were a personal door mat, floor mat in their lives, and just teaching them how to be more assertive in their communication style. It's amazing how liberating that can be for people. Or someone again who historically would always give in early in recovery, and then trying to teach them to be more assertive with their interactions with other people who may or may not be in recovery. So while a patient's say mode may be to be more passive or even perhaps aggressive, so if sort of your core person is to be more on the passive side or being more aggressive as an individual, we should at least provide them this alternative to understand that there is this middle ground of assertiveness that exists. So teaching assertiveness to a passive patient can really make them feel empowered, which is something I've heard people time and again tell me like, oh, I really appreciate learning this and it's helped my communication at home. A little bit more on applying assertiveness. So this is my son being assertive at Burger King years ago. I still use this as my phone, kind of my unlock screen, my phone. So I always love this picture, but he's very assertive, drinking his chocolate milk. So a little bit more into this. So actually, nursing students have been taught assertiveness techniques, and so they've gone into this. You know, nurses generally aren't considered to be non-assertive people, but they've gone and taught nurses how to be more assertive. So some results include improving self-esteem, which is pretty cool. Decreasing verbal abuse by surgeons in the operating room. Wouldn't that be lovely if you're a poor nurse who's getting yelled at by surgeons? So interactions with demanding patients using assertive techniques can help us navigate difficult situations. So if you have a really aggressive patient who wants something, being assertive with them can be helpful. So you want to have, which you'd say almost like an assertive co-pilot. So someone, in theory, let's say you were an airline pilot. You want to have someone that is assertive. You want to have someone beside you who can tell you, hey, you're doing this wrong, or maybe that setting is needs to be changed. If you have someone that's overly passive or defers to you, that's a good way for accidents to happen. So some accidents probably could be avoided if you had a more assertive person on the other end. Um, the other thing would be, you know, if you've ever been a part of like a board or like a group of some sort, I'm sure we've all served in some capacity at some point. But if you have a board where there's too many sycophants, so everybody, you know, nobody wants to really stand up and everybody's being very passive, we all know that that can be problematic very quickly. So the idea of groupthink or everybody thinking the same way or deferring to one individual as kind of an overwhelming, aggressive personality, that's not a healthy thing. So trying to be more assertive in your communications, whether it's with individuals or perhaps in like a group situation. All right, another application example, some examples. Say you have a depressed patient who always gives in to unreasonable demands at work, despite the fact that it's not part of their job. As a result, he rarely sees his family, and their depression continually worsens. This reminds me of occasionally. Teach them to be assertive with I statements and to use with appropriate body language. And often of note, a person that is more passive and they then are taught to be more assertive can get some initial backlash. So if their spouse or their boss at work is used to them being more passive, that can be quite jarring to have somebody suddenly standing up for themselves, being assertive. Another one would be a patient is demanding narcotic medications when they're not indicated. So this could certainly be an issue with the individuals we see. This would be a good place to teach ourselves to be able to say no. And if necessary, if they're not taking no for an answer, use more of like a broken record. I said no once. We're not doing this again. I'm saying no now. You're not getting this medicine. I'm sorry. All right. This is hard to do, of course, though, if someone's historically always given in to unreasonable demands. So if you always given the patient what they want, it's going to be kind of hard to teach them that no means no. All right, little interprofessional example application to like, so as people that work in mental health, and let's face it, we all more or less work in mental health. whether you want to or not, if you're treating addiction, it's a mental health condition. But we should understand behaviors better than really anywhere. But oftentimes, I feel like in terms of mental health people and somewhat also folks who work in addiction, we are expected to play more of a passive role in the hierarchy of medicine. So this is something that's always frustrated me, where it's more of a deference to surgeons or whatever it might be. There are options on how we can conduct ourselves. So one is we can be, again, non-assertive or passive or submissive, always saying, okay, we just work in mental health, or, we don't really know what we're doing. We don't really deserve respect, or we get pitied by other specialties, other physicians. Being aggressive or argumentative, this often leads to people, being more hated, or a message fails. So if you're overly aggressive, that can kind of undo good work that's done. Being more assertive, that really is, again, what leads to respect. So teaching people to be assertive in their communications, teaching ourselves to be assertive with interprofessionally. This may cause some initial backlash because they're used to us being more aggressive or being more passive. So it's different when you're assertive. But the ultimate goals I see of us using assertiveness is really decrease the stigma of mental health and addiction treatments, both for patients and providers. So the more assertive we can be, the more clear we can be with our messaging, both for patients and for other specialties, that will help ourselves, that will help patients. Little example we use. So let's say we're all at a conference and you run into somebody who's more like a general medicine person, and you hear them start saying like addicts, or talking about like people are junkies or worthless, or this person's bad, or this person's this person's that. That's a time where we don't really want to be overly passive and just kind of keep our mouths shut. This would be a good time to be, or being overly aggressive and scream back at them. This would be a time to be assertive and correct what's going on. So I'd say, I heard what you're saying. I don't care for the way that you're talking about these patients. I'd like you to, be more respectful for patients. That would be, that's something you could certainly do next. Lastly, into assertive treatment, what I would consider assertive treatment. So this is using the power of assertiveness to help further good treatments, also to help reduce the stigma of mental health and addiction, and ultimately to teach these assertiveness principles to both our patients and our colleagues. So I see assertive treatment as this catch-all where we're using these principles of assertiveness to better ourselves and better our colleagues in the field in general. So we need to really practice what we preach, but also to preach what we practice. So we're doing these things in our personal lives, in our professional lives or professional interactions, but also teaching people like our patients how to assertively communicate with one another and us. Again, hypocritical passivity or aggression will not help our patients nor ourselves to the utmost. So if we're overly passive or overly aggressive, that's not going to really help anybody. Avoid feeling guilt about our assertiveness. Again, being nice is not necessarily being the same thing as being good. So if you are being assertive, some people will not like that at times because they are used to more of a passive individual. And assertiveness is a tool, it's not a weapon. So the idea of assertiveness is not as a means to get your own way all the time. It's meant to be a way to communicate effectively with other individuals. And that's my son being very very passive, or not so passive. He's being assertive here. He's got his arms crossed a little bit. But yeah, this is him, and I loved his old shark backpack that he used when he was in kindergarten. It's pretty great. All right, a little quote on silence. I mentioned about, say you're at a conference and you hear somebody talking smack on our people. This is a nice quote I like to think of. It's Roxane Gay. All too often, when we see injustices, both great and small, we think, that's terrible, but we do nothing. We say nothing. We let other people fight their own battles. We remain silent because silence is easier. Qui tacit consentire, I think that's how you say it, videre, is Latin for silence gives consent. Silence gives consent. When we say nothing, when we do nothing, we are consenting to these trespasses against us. So when you don't say anything, when you don't speak up for yourselves, or when you don't speak up for your patients or colleagues, that is more or less giving consent. So in summary, assertiveness training really originally developed out of necessity. There's applications for ourselves and our patients. Four primary behaviors exist. One is being non-assertive or passive, being overly aggressive, being passive aggressive, or more the assertiveness, which is what we're aiming for. Being assertive is often, but not always, the best option for us as individuals and for our patients. Many different assertiveness training programs exist and techniques, so use them. There are numerous clinical applications for assertiveness, and strive towards assertive treatment. Do not remain silent in our interactions. So if we have any questions, and here's a little update on my kids. So that's us a couple years ago on a cruise. This is my son. He just won a reading award last week. He brought his team in first, so he's about the same height as that adult behind him. And then that's my daughter. Sorry, boys. Daddy is my Valentine, so don't mess with her. But they're being very assertive there, all of them. So assert oneself. Any questions at all? Try not being overly passive or aggressive.